What is Cuba's infant mortality rate? Have you ever wondered how a country's healthcare system can impact the lives of its youngest citizens? Let's take a closer look at Cuba's infant mortality rate and what it reveals about their healthcare system. Currently, Cuba's infant mortality rate is around 3.92 for 0.0 deaths per 1,000 live births, projected for the year 2025. This figure shows a remarkable decline from previous years, indicating ongoing improvements in healthcare for infants on the island. Historically, Cuba has made significant strides in reducing its infant mortality rate. For instance, in 2023, the rate was approximately 6.6 deaths per 1,000 live births. This decline is expected to continue, with projections suggesting a drop to about 3.94 in 2025. The Cuban government prioritizes maternal and infant healthcare programs, which play a key role in these positive outcomes. Cuba's healthcare system is a prime example of how socialist policies can lead to effective healthcare delivery. The universal, state-funded healthcare model ensures that all citizens have access to medical services, regardless of their income. This approach emphasizes preventive care, maternal health, and early childhood interventions. Programs aimed at increasing breastfeeding rates and improving healthcare professional training are just a few examples of how the government supports infant health. In 2024, 7 provinces in Cuba reported infant mortality rates below the national average. This demonstrates the reach and equity of healthcare services across the country. The Cuban healthcare model also addresses social factors that influence health, such as nutrition and education. By focusing on these social determinants, Cuba has been able to improve infant survival rates significantly. Cuba invests in various health interventions to reduce risks during pregnancy and manage chronic conditions that may affect maternal and infant health. These efforts contribute to the overall success of their healthcare system. The current infant mortality rate of about 3.9 deaths per 1,000 live births reflects the effectiveness of Cuba's socialist healthcare policies, which prioritize universal access and preventive care. This rate is comparable to or even better than many developed countries, showcasing how a publicly funded and equitable health system can achieve excellent health outcomes, even in the face of economic challenges. By examining Cuba's infant mortality rate, we can see how socialist policies in practice can lead to improved health for the most vulnerable members of society.